Hello everyone, myself Dr. Sanjay Kumar Soni, oral maxillofacial surgeon. In this video, I am going to discuss about the vasculature of the heart, head and neck. To know the anatomy of head and neck vasculature, one must know the embryology. So let's start with the embryology. Cardiovascular system is the first system to function in the embryo. In a developing embryo, the heart has developed sufficiently to start beating by 21st day. Blood begins to circulate by the end of the third week. Circulation patterns are clearly established by the fourth week of embryonic life. Earliest blood vessels develop from blood islands that are of mesenchymal origin. Blood island consists of two cells, central cells called as hematogeny or hemoblast. They give rise to primitive red blood corpuscles, erythrocytes or RBC. Peripheral cells, also called as angioblast, they become flattened and give rise to endothelial cells. Angioblasts then join up and form active blood vessel. During those first few weeks, blood vessels begin to form from the embryonic mesoderm. The precursor cells are known as hemangioblast. What is vasculogenesis? It is the process of new blood vessels formation during embryonic development of the cardiovascular system. Then angiogenesis, it is the creation of new blood vessels from the existing one. Now coming on to the aortic arches. The aortic sac divides into right and left dorsal aorta. What is dorsal aorta? It is a large embryonic artery formed by the fusion of the caudal part of the paired primordial aorta. Ventral aorta, the artery in vertebrates embryo that carries blood from the ventricles of the heart to the aortic arches. What are the aortic arches? Aortic arches are a series of 6 paired embryological structures which give rise to several arteries. These are short connecting vessels which connect dorsal and ventral aorta. They run within the branchial arches. Now coming on to the fate of aortic arch. By the day 27th, most of the first aortic arch has disappeared. Only small portion persist to form the maxillary artery. Second aortic arch soon disappeared. The remaining portions of the arch are the hyoid and stapedial arteries. Third aortic arch gave rise to initial part of internal carotid artery. External carotid artery originate from the cranial portion of the ventral aorta. Common carotid artery is the portion of ventral aorta between third and fourth aortic arches. The turnoaortic sac has divided so that sixth arch are now continuous with the pulmonary trunk. The fourth aortic arch has ultimate fate different on the right and left side. On the left side, it forms a part of the arch of aorta between left common carotid and left subclavian artery. On the right side, it forms the proximal segment of the right subclavian artery. The fifth aortic arch is transient and soon obliterates. The sixth aortic arch, also called as pulmonary arch, gives off a branch on each side that grows towards the developing lung bud. The proximal part of the sixth right arch persists as the proximal part of the right pulmonary artery, while the distal section degenerates. The sixth left arch gives off the left pulmonary artery and forms the ductus arteriosus. This duct remains previous during the whole of the fetal life but when the but then closes within the first few days after birth due to increased oxygen concentration. And you know what? There are three major shunts, or we can call as alternate pathway for blood flow, found in the circulatory system of the fetus. Two of these shunts divert blood from the pulmonary trunk to the systemic circuit, whereas the third connects the umbilical vein to the inferior vena cava. Now coming on to the first shunt, also called as foramen ovale. It is an opening in the interarterial septum that allows blood to flow from the right atrium to the left atrium. A valve associated with this opening prevents backflow of the blood during fetal period. As the newborn begins to breathe and blood pressure in the arteria increases, this shunt closes. The fossa ovalis remains in the interarterial septum after birth, marking the location of the former foramen ovale. Second shunt is ductus arteriosus. It is a short muscular vessel that connects the pulmonary trunk to the aorta. Most of the blood pumped from the right ventricle into the pulmonary trunk is thereby diverted into the aorta. Only enough blood reaches the fetal lungs to maintain the developing lung tissue. When the newborns take the first breath, pressure within the lungs drops dramatically and both the lungs and the pulmonary vessels expand. As the amount of oxygen increases, the smooth muscles in the wall of the ductus arteriosus constrict, sealing of the passage. Now, coming on to the third shunt, ductus venosus. It is a temporary blood vessel that branches from the umbilical veins, allowing much of the freshly oxygenated blood from the placenta to bypass the fetal liver and go directly to the fetal heart. The ductus venosus closes slowly during the first weeks of infancy and degenerate to become the ligamentum venosum. Now, coming on to the structure of blood vessel. The outermost layer is known as tunica externa and is composed of connective tissue made up of collagen fiber. Inside this layer is the tunica media, which is made up of smooth muscle cells and elastic tissue. The innermost layer, which is direct contact with the flow of the blood, is the tunica intima. This layer is made up of mainly endothelial cells. The hollow internal cavity in which the blood flow is called as lumen. Now coming on to the branching pattern of blood vessels. As we know, artery, they conduct oxygenated blood away from the heart to the tissues. Blood vessels become smaller in diameter. Arteries branch into arterioles, which becomes capillaries. Then veins, they conduct deoxygenated blood back to the heart. They increase in diameter. Capillaries become venules, which joins to become vein. Now coming on to the difference between arteries and veins. On the blood, arteries carries pure oxygenated blood rich in nutrients, and veins they carry deoxygenated blood rich in waste. Based on the structures, arteries wall are rigid, thicker and highly muscular, and in case of veins, walls are thin and collapsible walls. Based on the location, arteries are deeply situated within the body. Veins are superficially located, closer to the skin. Based on their appearance or color, arteries are red in color, veins are blue in color. Based on the direction of blood flow, arteries carries blood away from the heart to the various part of human body. Veins carry blood from the various part of the body towards the heart. Based on the flow pressure, the pressure in the arteries high as the blood flows by the pumping pressure of the heart. And in case of vein, the pressure is low as the blood flows by the capillary action of the vein. Based on the oxygen level are quite high in the arterial blood, and oxygen level is low comparatively in veins. And one more interesting fact, all arteries carry oxygenated blood except the pulmonary artery, which carries deoxygenated blood from the right ventricle of heart to lungs. And all veins carries deoxygenated blood except the pulmonary veins, which carries oxygenated blood from lungs to left atrium of the heart. Now coming on to the branches of aortic arch. Branches of arch of aorta, the main blood vessels that originate from the left ventricle. Branches are number 1, innominate artery. Innominate artery further divides into right common carotid artery and right subclavian artery. Other branches of aortic arch are left common carotid artery and left subclavian artery. As we can clearly see in the diagram, this is the right side innominate artery that further divided into right common carotid artery and right subclavian artery. This is the left common carotid artery and this is left subclavian artery. Now coming on to the subclavian artery. Subclavian artery divided into three parts by scalenus anterior muscle. First part lies middle to the muscle, second part lies posterior to the muscle, third part lies lateral to the muscle. Now coming on to the branches of the first part of the subclavian artery, that is vertebral artery, internal mammary artery, thyrocervical trunk. Thyrocervical trunk further divided into supracapsular artery, inferior thyroid artery, and transverse cervical artery. Now coming on to the right common carotid artery, it begins at the bifurcation of the innominate artery behind the right sternocostal joint. It has only cervical portion. It has no thoracic part. Coming on to the left common carotid artery, it originates from the highest part of the arch of aorta to the left of and in a plane posterior to the innominate artery. It has both thoracic and cervical portion. The thoracic portion begins at the arch of aorta and ascends in the superior mediastinum to the level of the left sternocostal joint where it becomes continuous with the cervical portion. Now coming on to the cervical portion of both common carotid artery. It ascends obliquely upwards from the sternocostal junction and it ends at the level of upper border of the thyroid cartilage where it divides into internal carotid artery and external carotid artery. Thank you. In my next video, I am going to discuss in detail about internal carotid artery and external carotid artery.